For the next few minutes, I'm going to discuss what happens in the brain of an individual with fibromyalgia. The exact pathophysiology of fibromyalgia is unclear. We know that normal pain processing involves two neural pathways, an ascending pathway and a descending pathway. The ascending pathway I'll be representing in the color red, and the descending pathway will be in blue. The ascending pathway involves our peripheral nerves that transmit nociceptive signals to the spinal cord and up to the brain for processing. So for example, if I apply a point of pressure onto the skin, that information is going to be sent through the spinal cord and up to the brain, where the brain is going to think, what was that pressure and how am I going to react to it? Now in the descending pathway, we have inhibitory pain signals that are sent down from the brain to the spinal cord and out to our periphery. So that information is going to tell us whether we feel increased or decreased pain. So, ow, that hurt so much, or that wasn't too bad. For fibromyalgia patients, there is a change in these ascending and descending pain signaling pathways that cause a hyperactive detection of pain, and it has to do with the imbalance of some important neurotransmitters. The first neurotransmitter we're going to talk about is glutamate, which is involved in the ascending pathway. So I'm going to write it right here in red. Research shows that fibromyalgia patients show that they have abnormally high levels of glutamate in a part of their brain called the insula or the insular cortex. So because glutamate is present in abnormally high levels, I'm going to put an arrow here to show, to represent that. Researchers went looking here because the insula is very involved in pain and sensory perception. Glutamate works to excite our sensory tract, and in the process, it increases the transmission of pain signals. So I'm also going to put a little plus sign to show that glutamate is excitatory. The next chemical that is not in balance is GABA, and GABA is part of the descending pathway. Research shows that low levels of GABA are present in patients with fibromyalgia. The primary function of GABA is to inhibit and suppress the sensation of pain and anxiety. So GABA here is going to be inhibitory. It essentially works to calm your brain. So you can imagine that low levels of GABA means that we're no longer able to suppress pain and anxiety. The next few chemicals that we're going to talk about are serotonin, norepinephrine, and dopamine. These are considered to be our feel-good neurotransmitters. In order for us to feel good, they help to block our perception of pain. So they all work as inhibitory. They are present in low amounts in patients with fibromyalgia. I'm going to show the arrow here to show that they are decreased. So essentially, they are not available to block our pain reception as normal, and so our pain perception becomes heightened. The diagram that I've drawn here is thought to be the reason for why patients with fibromyalgia experience chronic and constant pain because of these altered levels of neurotransmitters. And I use the arrows here to represent whether there is an increase or a decrease in the certain neurotransmitter. As mentioned in the handout, some medications can be used to slow down the chemical impulses of the brain that heighten our perception of pain to restore some of this balance.